Let us continue with the contents of axilla. We have seen the axillary artery. Now we will see the axillary vein. So this is the axillary vein. You can see it accompanies the axillary artery in its medial side. The axillary artery begins at the outer border of first rib and continues as the brachial artery at the lower border of teres major muscle. So the axillary vein begins at the lower border of teres major muscle by union of the two venae committents or veins accompanying the brachial artery. They unite together at the lower border of the teres major muscle, into which the basilic vein also ends. The basilic vein is the medial vein of the arm, upper limb. So it also joins with venae committents of the brachial artery to form the axillary vein at the lower border of the teres major muscle. And axillary vein, after its formation, ascends up medial to the axillary artery up to the outer border of the first rib, where it continues as the subclavian vein. Now about the tributaries of axillary vein, first and foremost is the cephalic vein. So that is the cephalic vein. The cephalic vein is the vein of the lateral side of the upper limb. It passes through the deltopectoral groove, then pierces the clavipectoral fascia to drain into the cephalic vein. Note that it crosses the first part of the axillary artery before draining into the vein, and also that the angle of drainage is 90 degrees between cephalic vein and the axillary vein. The clinical importance is that if you want to pass a catheter into the heart through the cephalic vein, it will be very difficult. That is, cardiac catheterization means a catheter is passed through a peripheral vein into the heart. So, if you want to pass the catheter through the cephalic vein into the axillary vein, it will be difficult, whereas you can pass the catheter through the basilic vein into the axillary vein because they are more in line with each other, and the catheter can be passed through the axillary vein to the subclavian vein, then into the brachiocephalic vein, superior vena cava to the right heart. Okay. Now the other tributaries of the axillary vein accompanies the branches of axillary artery. Now you can see that the thoracoacromial vein and the cephalic vein crosses the first part of the axillary artery. So when you mention the anterior relations of first part of axillary artery, you can mention these veins also. Now about the clinical importance of axillary vein. First is about axillary vein thrombosis. Axillary vein thrombosis means blood clots within the axillary vein. Now, when the blood clots within a vein, it can pass into the heart and then right heart and then into the lung, and that is called pulmonary embolism, which is fatal. So, thrombosis of deep veins are a major concern. So, axillary vein thrombosis is common in persons who use their arm over abducted. That is, persons using hands with raised above their head during their work. Example, painters. Now, another important factor is that there may be a fibrous band connecting pectoralis major to latissimus dorsi, that is anterior and posterior axillary folds, that is called axillary arch. In presence of axillary arch, the axillary vein thrombosis is common. So these are the clinical importance of axillary vein. First about the cardiac catheterization, and then the axillary vein can be used for intravenous fluid administration. You can dissect out the vein in the deltopectoral groove, where you can also see the deltoid branch of thoracoacromial artery. Okay, so these are the clinical importances of axillary vein.